Everyone's heard about omega-3s for heart health. But what if they can actually cause other heart issues like atrial fibrillation? My name is Dr. Paul Herkel. I want to dive into this particular topic that really became a bombshell in 2021 when this paper and one very similar was launched and published talking about omega-3s increasing the risk of AFib in large randomized controlled trials. So this was a systematic review and meta-analysis. So let's get into this one that was published in the May of 2021 by Jia and other authors. And this is the basics of the study. They looked at 8 randomized controlled trials, over 83,000 participants. Now this is a massive number. And specifically, they looked at pharmaceutical supplementation. This was not looking at the consumption of fish. Very important to point out, which we'll circle back to at the end. In the meta-analysis, basically what they found is that there was a significant association between supplementing with omega-3s and getting an increased risk of AFib. Roughly about 0.7% increase. Now that is a relative risk of about 24%. 24% seems like a big number when you actually look at the absolute number of increased risk. It's 0.7, it's not that big, but it's still statistically significant. And this is the first time that this was actually identified, so this is why it really raised a lot of alarm bells. Just breaking that down a little further, there were 5 studies that assessed a lower dose, and they had a much smaller but still significant association, about 12% relative risk increase. And then the 3 trials that had the higher dose had a bigger increase, over about 51% increase in relative risk. So there definitely was something going on in these papers. Let's see if we can actually take a deeper look and understand why this is happening. In summary, it's important to break down the difference between low dose and high dose. Higher dose in the bottom studies here had much higher risk here. And if you look at it, we're not going to go into each one of these studies, but for example, the strength study was using an ethyl ester form of fish oil at about 4 grams. Now, this is a pretty big dose. Ethyl ester is not a great source of fish oil. I know that's kind of the pharmaceutical model. It is an unnatural form of fish oil that actually is part of the process in taking the omega-3s out from the natural triglyceride form. And the way that we have it in our body is in that triglyceride form. But it's easier for manufacturing, so a lot of supplementation of high dose omega-3s is left in ethyl ester form. Generally not great, not well tolerated. So I'm wondering maybe that could be causing an issue. There was some criticism of this study, of course. A lot of people know omega-3s are really good for heart health in terms of preventing death from dying of a heart attack or coronary heart disease. So if a person lives longer, if they're taking fish oils, maybe as you get older, you're going to have an increased risk of developing atrial fib. And this is a criticism that they maybe didn't adjust for these risk factors. Because they're living longer, they're getting more side effects. That's interesting. And we know that there's a lot of cardiovascular benefits independent of this whole new AFib thing that omega-3s supplementation bring. So there's some more pieces of information to give us a little more context here. In 2023, there was a UK Biobank study, and this is a massive collection of people, over 200,000 people that have all this blood that's been stored, and now all these researchers are digging in, looking at all these factors. And what they found here is that those people that have the highest levels of omega-3 in their blood, which is associated with omega-3 intake and diet and also supplementation, they had a lower risk of AFib. But they also had a lower risk of dying of all causes, heart failure, and stroke. These are obviously really positive things and things you'd expect out of omega-3 supplementation. But in 2022 and also in 2024, on the same group of patients, they found that the fish oil users had the opposite or a higher risk or incidence of atrial fib. Again, small percentage increase, but conflicting research. So we have these randomized control meta-analysis showing that you have an increased risk of AFib. Then you have the serum levels of omega-3s, which have always for the last 50 years been associated with lower risk of heart issues, now showing that it may increase the risk of atrial fib. And what the researchers have found, again, there's a very dose-specific effect. So the higher the dose, over 1,000 milligrams or 1,500 milligrams, there is an increased risk. And there is biological rationale here. Fish oil supplementation changes the vagus nerve tone, and that's that connection between the brain and the heart and in the entire abdominal organ system. And so that can omega-3 supplementation can actually change that, and that influences potentially heart rate in some susceptible individuals. But there could also be a protective effect. Gets a little more confusing. But don't despair. I'm going to leave you with probably the most recent and maybe the definitive piece of research that, at least from the UK Biobank study group, we can identify what the actual benefits are. Very recent December 2025 study, and they looked at that same US Biobank group, and what they concluded was that higher omega-3s in the blood were associated with lower incidence of AFib. And what they did differently here compared to that 2022 and 2024 study that found the opposite is that they made a key statistical analysis change, and they adjusted for continuous rather than dichotomous stratification in the groups. So they didn't break up different ages. They continued the analysis throughout all ages. And when they did that, the risk was eliminated. Again, if you break the analysis group up into groups, of course, the people that are older, that maybe are living longer because of the supplementation, but also may have an increased risk for AFib, they are going to change the outcome or the data weight of that study. But if you do it continuously, that's now going to have a more accurate way of doing it. Continuously is the gold standard here. So you can see here, the older a person gets, as you can see, 65 plus, they have an increased chance of AFib for sure. Look at that blue line, but they're also taking more fish oil, and that needs to be continuously adjusted. So the takeaways is that this biobank study doesn't totally explain the data that was published in that big meta-analysis in 2021, showing an increased risk of AFib in those randomized control trials, but it does give us more confidence that the higher the levels of omega-3 in a person's bloodstream, the lower the risk of AFib, along with all those other really great effects like dying of all causes. That's a big one. Generally speaking, most interventional clinical trials that have been supplementing with omega-3s, EPA and DHA, have had very positive outcomes, and only very few of them, as that meta-analysis showed, only 8 of them actually looked at AFib. The other ones maybe didn't look at it, or they didn't think it was important, or they just didn't actually find it in their study. So the bulk of the evidence still shows that there's no major issues. So what are the takeaways that we all need to know? One of them is that we still need more research to actually figure out if this connection is true, why it's happening. I know that those 2 studies that were published in 2021 definitely cast some doubt on the overall safety of omega-3s for a lot of people, but the reality is that they are extremely safe despite this. And the risk is very, very small, especially in people that are older and have a lot of comorbidities, like they have cardiovascular issues, they have previous history of cardiovascular events, obesity, diabetes, etc. Those are precisely the people that need to be taking omega-3s for all their protective beneficial effects. So I think a lot of experts that I've spoken to feel that the risks definitely are much lower than the benefits, and the benefits outweigh those risks. When we're talking about omega-3s, always talk to your healthcare provider to see if this is right for you. We never know in terms of medication interactions, so that is a key piece to discuss. Look for a triglyceride form of omega-3s. This is the form that's naturally found in fish, and it's the form that's found in your body. And this is the form that's best tolerated, and I think that's going to minimize a lot of side effects, especially digestive upset. And then evidence-based doses based on the papers that I just talked about here are somewhere between 500 to 1500 milligrams. There's some evidence to show that higher levels are more beneficial in some cases, like prevention of death from heart attacks. However, the risk of AFib goes up. So maybe if you're at high risk or you have a history of AFib, this might be a consideration for you to keep a moderate dose. But talk to your healthcare provider to make sure it's right for you.